Hello, and thank you for joining the DCC live stream town hall series, where we are going to be focusing today on the COVID-19 vaccine. I'm your host, Lindsay Combs, and I'm in charge of clinical communications and outreach. First, we'd like to commend you on staying strong and resilient as we continue to move through one of the hardest times our world has ever faced in this lifetime. A global pandemic is no joke. And we thank you for the dedicated care you continue to provide our patients and each other. We'd like to start by communicating that we advocate for the vaccine. It is a personal choice whether you choose to receive it or not. We hope that you feel you can come to us at any time with questions or concerns about the vaccine, and we can help you better understand your risk versus reward. We care for a patient population that is high risk, which means they are more vulnerable to catching and suffering from COVID-19 and any of its mutations. It's important to note that we should not be encouraging our patients to not get vaccinated based on our own personal beliefs. We hope that at the end of this town hall, you will feel well equipped with the necessary knowledge to move forward in your decision-making process. With that being said, it's very exciting to say that we are already seeing large numbers of our staff and our patients who have been vaccinated or are actively working towards getting vaccinated as it becomes available to them. Thank you to everybody who's doing their part to stop the spread of COVID-19. In today's town hall, we're going to be talking with Dr. Shafi and Dr. Alausa to answer the questions that you submitted ahead of time, as well as other important information. So let's jump right in. First, I'd like to introduce to you the Chief Medical Officer of DCC and Chairman on the Board of Directors for the nonprofit Infection Prevention and Control Foundation. Please welcome Dr. Shafi.
Hi, thank you, Lindsay. Welcome, DCC family. I'm really excited to be in this town hall meeting to answer your questions about this very important topic of COVID-19 vaccination. I welcome you all again.
Great. Thanks for being here, Dr. Shafi. Well, let's get right to it. We have a really great question that's coming to you from Janaea Franklin, Procurement and Inventory Specialist.
Dr. Shafi, my name is Janae from Inventory, and I was wondering how the vaccine produced so quickly, and how do we really know if it's safe? And minimal research has been done in the long-term effects of getting vaccinated.
Thank you, Jeanette. I think this is a very important question that you raised. And I agree with you that this process of developing this vaccine was rather short, knowing that a lot of these previous vaccines took years to develop. But you have to understand messenger RNA technology was in research for a number of years. So the framework and the research was done, and when this crisis came, the technology was there to develop this vaccine. And the data for regarding this vaccine was presented to FDA. It was tested across a lot of different population, different areas of the world. And once its efficacy and safety was established, the data was presented to FDA, and FDA looked at the data, knowing it was so effective, and looked at all the side effects, and they readily approved this vaccine. Also, you have to understand that messenger RNA, we are not talking about a live virus that is being injected into the body. It's a portion of messenger RNA that is injected into the body that stimulates your body cells to produce what is called a spike protein, again, a harmless piece of protein that induces an antibodies. And so basically the whole technology, always very novel, very new. It's very safe, and I must admit that the safety has been very now, every day is being established with more patients being vaccinated.
Great. Thank you, Dr. Shafi. All right, throughout this town hall today, we're going to be busting some common myths here with the COVID-19. Let's start with our first myth. I don't trust the vaccine because it was rushed. That is false. Messenger mRNA technology has been underway for 30 years. It's true that this is the first vaccine using this technology, but the science has been studied and is well-founded. All right, now that we know a little bit more about mRNA technology, let's roll right into our next question for you, Dr. Shafi. This one comes from Tim Burns, one of our biomed technicians.
Hi, Dr. Shafi. Should we anticipate COVID vaccinations to become routine going forward, as the vaccines may need to keep up with mutations or variations of the virus? And if so, can an mRNA type vaccine be administered safely and effectively on a repeated and routine basis?
Tim, again, a very important topic about mutations. As we know right now, the current vaccines do cover for the mutations that are prevalent in America, especially the UK strain, so-called UK strain. Should we get booster dosage in future? That is an area of active research. I know Moderna, Pfizer, both are looking at it, giving a booster dose later down the road. But for now, I think we are adequately covered by receiving this vaccine. And you have to also understand, by getting vaccinated, we are also stopping the evolution of these mutation strains. And mutations evolve when patients are not vaccinated. So by vaccinating ourselves and vaccinating a large population, we are also preventing the spread and evolution of this mutation. So to answer your question, there's a possibility future down the road, we may have, this becomes a routine every year we have to get this vaccine, or this vaccine may last its effect for many years. So this is an area that is currently being actively researched.
Great. Well, thank you, Dr. Shafi. We know that you've been vaccinated. Is it safe to say at this point you'll be encouraging your family and your friends to get vaccinated as well?
Let's see, absolutely. There's no question about that. My kids, my wife, they are looking forward to getting vaccinated and, getting back their life back to normal. You know how this COVID-19 has affected us, not only professionally, but socially, with all kids doing their education from home. So they are really excited and looking forward to getting this vaccination.
Oh, great, great. Well, let's go to our next question, Dr. Shafi. This one is coming from Megan Ginn, one of our PD nurses.
Hi, Dr. Shafi. I was just curious if after I get the vaccine, am I still able to infect others?
Yes, Megan, this is again a very important question, and I want to kind of educate our DCC family about the concept of this herd immunity. And so just as you have heard that, we have to achieve at least 70% of either getting vaccinated or 70% of population getting infected, then we achieve this herd immunity. This concept of where you stop giving the COVID to other people, this concept is called as sterile immunity. And as we speak right now, the data is emerging, the data is evolving. I could tell you that so far the studies have indicated that it does reduces the transmission of COVID to others once you are vaccinated. And until we have this data there, I would recommend to everybody that we continue to use masks, we do social distancing, we frequently wash hands, avoid big gatherings, but definitely that would be the benefit of the vaccination, that not only we are preventing ourselves from getting vaccinated, but we are also preventing the spread of COVID-19, giving it to others, which I described is called as a sterile immunity.
Great. Thank you, Dr. Shafi. Let's bust another myth, all right? After I receive the vaccine, I won't need to wash my hands, wear a mask, or socially distance. This is false. You may not have developed immunity immediately following inoculation, and studies are still underway to determine whether or not those vaccinated can still carry and pass on the virus. Let's get into side effects, Dr. Shafi. There's been a lot of concerns over side effects. People are experiencing them both after the first and the second shot. They're seeing things like muscle aches, fatigue, chills, soreness at the injection site. As a medical doctor, what are some of your recommendations on working through these side effects?
Lizzie, you're right. The side effects profile is kind of variable person to person, I've seen some developing very mild side effects, some may be more severe. Must admit, I did experience some soreness at my injection site. I had some myalgias for 24 hours. The good thing is that they are very time limited phenomena. So most of the people who are going to experience these side effects, whether they're severe or less severe, are going to be not more than 48 hours. And during those time, you can take Tylenol round the clock. You can drink plenty of water, keep yourself hydrated. So I think those side effects are very manageable. And I told you, these vaccines are being administered on millions of people every day. And we are learning more about it. And I must admit, so far, so good. These vaccines are effective with minimal side effects.
Yeah, that's great. And, I think it's important that we point out that the side effects related to COVID-19 could ultimately mean death for you or a loved one, right? Many of us are working parents or even still take care of our own parents. And so it's important that we look at the vaccine as a source of protection against COVID-19 and any of its mutation. I know a lot of people are talking about the emotional aspect of getting vaccinated and how they feel that a weight has been lifted off their shoulders, that, like you said, Dr. Shafi, they're now feeling like they can get back to some sort of normalcy in their life. Our kids can go back to playing with their friends without masks on. They can go back to school. It's really promising to see that there is a light at the end of this pandemic tunnel, and then most people are choosing to get vaccinated, which will really help stop the spread of COVID-19.
Absolutely.
So before we get to a story about one of our own who survived COVID-19, let's have one more question for you, Dr. Shafi. This one comes from Kathy Camargo, one of our new PCTs.
Hi, Dr. Shafi. Many of our patients are excited to get the vaccine. What is some general information we can provide while they wait to get vaccinated?
Again, a very important question, and I'm being asked a lot by my patients also, that when I'm going to get the vaccine. And I must admit that every state has different rules and regulations regarding rolling out of the vaccination program. Most of these rolling out programs are based on the age and comorbidities. And I would strongly recommend that use your resources such as the hospitals, your primary care doctors, your public health departments. They all are updating the status of vaccine supply on a day-to-day basis. Register yourself, check the status every day. And those individuals who are doing that, I'm telling that everybody is getting their turn to get vaccinated. Now, the good news is that President Biden has promised us by May 1st, this vaccine will be available to all of us, all of the population, regardless of their age, regardless of their comorbidities. So that's a very, very good news for everybody, that they would have access to vaccine on May 1st onwards. So please do use all the resources on hand to get yourself registered.
Great. Thank you so much, Dr. Shafi, for being here with us today and answering these questions. We appreciate it.
Thank you, Lindsay, again, and thank you for participating in the town hall meeting.
Great, thank you. Let's talk stats for a minute here. The United States alone has seen over 29 million cases of COVID-19, with over 530,000 deaths. While this virus has affected each and every one of us, it has disproportionately singled out communities of color as it makes its way through our cities and towns. Many of our own employees and patients have had COVID-19 and have since recovered with little to no side effects. Others have not seen that same fate. I was able to sit down recently with one of our own who went head to head with COVID-19. I'd like to introduce to you the story of Jackie Jeffers, our clinical area manager in Region 4, Pennsylvania. Jackie, how are you feeling today?
Hi, Lindsay. How are you? I'm doing better than I was. Thank you. Recovering.
Good, thanks. I know you've been really busy the last few days attending multiple doctor's appointments. So thanks for taking the time on this Saturday to join us for this interview.
You're welcome.
Great. Well, we are really excited to hear your story about surviving COVID-19. Let's jump right in. When did you know that you had contracted the virus and that things weren't okay? You needed to go see your doctor.
The week before Christmas, I knew that I had started coughing because my children had made me aware that they heard me sporadically coughing, which I didn't think anything of it because I didn't have a sore throat at that time. I didn't feel sick. And once they told me, I immediately, put a mask on just to be cautious. And I didn't think that I had COVID though.
Okay. Yeah. So you must have just went to your doctor. Obviously, you tested positive at that time for COVID-19. Did they send you home or send you to the hospital? Were you expected to quarantine? And what about your family?
At that time, when I made a doctor's appointment, basically after I was made aware that I was coughing, the next day I felt tired. The next day I was not feeling well. And it just seemed like it was progressing day after day that something was going on. So I did quarantine myself from my family, went to my family doctor. She ordered a COVID test and it came back positive. So I had already quarantined myself from my family. Now it was just more so in the room.
Okay. So you were quarantining at home, but that's not the end of your story. Things actually didn't start to get better for you. They started to get worse, and you ended up in the hospital several times. Jackie, at what point did you feel like you couldn't stay at home quarantining anymore? You had to go to the hospital.
So initially, when I was diagnosed with COVID, I had to do daily reporting with the COVID team at Thomas Jefferson Hospital. They told me once my SAT goes to below 95 to call. So my SAT at that time was 92 and 93, and I had back pain like 10 out of 10, and I couldn't breathe. So I went to the emergency room at Thomas Jefferson, and they had told me that I had some atelectasis, I had some pleural effusion, and something called ground glass throughout my lungs, which is basically the COVID. Just they can see it on the film that it was spread out throughout the lungs, and that I had pneumonia.
Okay. Wow. And you said your breathing was really, really hard. You must have been really scared. At what point did you end up getting admitted to the hospital for a lengthy period of time? You were still suffering from COVID-19, but you'd actually gotten worse. Tell us about that and what had happened.
So I was in the hospital a couple times here and there. And then my lengthy stay was after about 3 weeks after I was diagnosed with COVID. I, stood up and my heart rate just standing was like 165, and it was going to 200 if I took a stat. So I was feeling really bad, dizzy, fainting. Chest pains were 10 out of 10. I was admitted, given nitro, Decadron, steroids, antibiotics for pneumonia. They didn't initially treat me with antibiotics for the pneumonia, which they delayed until I think about 2 weeks later. I remember calling Dr. Lassa and Monique, because I didn't know what to do. I was very, very scared. Information in the hospitals, they're learning, these doctors and nurses are learning how to treat it. And each case is done differently. It's not a standard way of caring for someone. Even me as a nurse, I knew what to do at certain points, but when you're going through it and experiencing it, it's something totally different, you know?
It sounds like a guessing game almost for these healthcare professionals, because this is something that they've never seen before or had to deal with. So, you getting to experience that firsthand. And, it seems to me like you've been suffering from what experts are kind of referring to as these long haul COVID symptoms that stay with many patients after they've started to recover from COVID-19. You have something called POTS, right, that you've been diagnosed with. What is that again?
It's postural orthostatic tachycardia syndrome. Mine is related to COVID. Some people, most doctors see it in women who are pregnant, but mine is from a virus, which when I stand up, like I said, my heart rate goes up without me even taking a step to like 140 to 165.
Wow.
And when I'm walking, it can go over 200. So,
okay. Wow, how scary for you. And, you and I had talked about your hospital experience, and you had mentioned how it was often that you would press your call button and it would be sometimes hours before a staff member or a nursing student only would come into your room to address your pain or take you serious. And Jackie, that had to have been so scary. Was there any time during your hospital stay where you really had those feelings like, I don't know if I'm going to make it. I might die. I might never see my family again?
Yeah, I certainly felt that way. I would call and no one would come. And sometimes the nurse wouldn't even come until the next shift. And I called the case manager, like I said, as a nurse, you know what to do. You know who to complain to, you know who to call, but no one would come. An aide would open the door, close the door, and tell me, okay, the nurse will be back with you. Medical student, a nursing student who was training would say, okay, I told the nurse is on their way. Nurse never came. And I pressed it, they just clear out the call button. And I was complaining that I was still having those chest pains. My heart rate was still in the 200s. Nobody came. It was very, very scary.
Wow.
Something I never thought I would experience.
Well, we're happy to see that you were finally discharged and got to go home. But once you went home, Jackie, you told me you had to quarantine for a very long time because you were still testing positive. You and I've talked many times. I know that you're a working mom. You have 3 kids, one of them being young, being 7. And throughout this time, a lot of these kids have been at home doing hybrid homeschooling. I imagine you being quarantined in your room, you weren't able to hug them, touch them, help them, cook for them. What was that like? Tell us your home quarantine experience.
So I was in the room from the time I got diagnosed on December 24th, and I came out of my room on March 3rd. So I stayed quarantined in my room. My husband took care of me. My children stayed outside of the room. And my little one would curl up by the door, sending me notes underneath the door. But most of the time I was too tired to even get up to get them, to read them.
Wow. Wow. Yeah, it sounds exhausting. It must have just broke your heart. From what we've learned today, we know that people who have survived COVID-19 can't get vaccinated until about 90 days after they are no longer testing positive. I don't imagine you're in that boat yet, Jackie, but when the time comes, are you planning to get vaccinated?
I am planning to get vaccinated. My family, my sisters, my father, they're all vaccinated. My husband's vaccinated. My 18-year-old daughter, my 22-year-old daughter, who has asthma, she also is vaccinated. After watching me and I'm still very, very tired. I get tired and winded still. Watching me go to a pulmonologist, a cardiologist, a neurologist, for all of this, and seeing what I'm going through, that was enough for my family. Like right now, I still have to be monitored by a cardiologist. I'm being monitored daily with a Holter monitor that, I have to wear every day, that I've had now for a couple of weeks. So this has been a lot.
Yeah. Well, we're so glad again that you're here to share your story. We thank you so much for your time, Jackie. And we really just want to say, everybody, please put out your prayers and your blessing for Jackie and her family as she continues to get better. All right, Jackie, you take care. You have a great day.
Thank you, Lindsay.
All right. Thank you so much to Jackie for telling her story. Please remember to keep her in your thoughts and prayers on her journey of recovery from COVID-19. All right, let's bust another myth. There are severe side effects to the vaccine. This is false. There may be short-term side effects, especially when the second injection. 15% of those inoculated may have irritation where they received the shot, and up to 50% may get a headache or chills for a day. All right, well, here comes Ann Mattis, our Director Manager of HR, who's getting her live vaccination now.
Ann from HR.
2, 3.
Ouch, looks like it hurt. Thank you, Anne, for getting vaccinated. And thank you again to Megan and her team for giving the vaccination. All right, we're here to bust another myth. Now that we have the vaccine, the pandemic will be over soon. This is false. Herd immunity won't be achieved until 70 to 80% of the population has received the vaccine or recovered from infection. That's not expected until mid to late summer at the current vaccination rate. All right. At this time, we want to give a big shout out to our DCC ambassadors. This is the most prestigious award that you can win here at DCC. It's given out quarterly, and our staff is nominated by our senior clinical leadership team. And it really goes to people who have just gone above and beyond for both their patients and for each other. Everything that they do 100%. Today, we want to announce the winners of our first ever DCC ambassadors. Please welcome and be congratulating Quintana from Georgia and Ernestine from Illinois. Thank you so much. There's Quintana. All right, and there's Ernestine. If you work with them or see them, please feel free to give them a shout out or shoot them an email congratulating them on winning their award. All right, at this time, I'd like to introduce to you the owner and operator and chief medical officer of both DCC and KCC. Practicing nephrology for over 20 years, please welcome our very own Dr. Alausa.
Good afternoon, everybody. Thank you, Lindsay. Welcome everyone to the this town hall meeting that we're doing to improve and enlightenment about COVID-19 vaccination. And thank you. I'm happy to be here and to be part of the town hall meeting.
Great. Well, I know earlier this week and last week, you were there at our Olympia Fields location to administer the first vaccine to one of our patients. That seemed amazing. Tell us a little bit about that, Dr. Alausa.
Lindsay, I thank so much. It was, I can't even explain what it feels like to be part of the clinical team that vaccinated our first patient at DCC Olympia Fields here in Chicago suburb in Illinois. it was just it's like a hard life-changing thing, and I'm happy that the patient actually received the news about DCC providing vaccines to our patients and staff. They're very excited and encouraged, and a lot of them are getting the vaccines already.
That's awesome. The pictures were great, and there was really great energy there. So thank you so much. Let's jump right in, Dr. Lausa. We have some questions coming to you from staff who submitted them anonymously. So I'll go ahead and read those to you. Our first question, somebody says, I heard someone say that the vaccine will change my DNA. Is this true?
Lindsay, that is absolutely false. There's no way physiologically, biochemically, or genetically that the mRNA vaccine will change anyone's DNA. I'll tell you a little bit about mRNA and DNA. DNA, every single cell in our body, we have billions of cells in our body. The center part of the cell is the nucleus. That's where the DNAs are located in. The mRNA are located around the cells. So this vaccine was designed to target a specific part of the COVID-19 virus, which is called a spike protein, which is an mRNA. It targets the surface of the cell. It never goes inside the cell. So this does not it will never affect anybody's DNA. It's just all the mischievous propaganda that is being perpetrated, but which is not based on science. So let me repeat it first. mRNA vaccine, the COVID vaccines will never change anybody's DNA.
Thank you so much for clearing that up, Dr. Lausa. We appreciate it. All right, we have another question coming to you. This one asks, is the company going to offer any PTO or reimbursement if we have to deal with these severe side effects of the vaccine?
Oh, Lindsay, thank you again. That's a very good question. I'll tell everybody it's very rare for people to suffer from severe side effects after taking the vaccine. But I'll encourage you to work with your clinic manager to get your vaccine on the day that you know you have the opportunity to rest. Now, most of our clinic are open Monday, Wednesday, Fridays anyway. So you can either go on Thursday or Tuesday or Thursday to get your vaccine when you're not working. So, but we will support you. The organization will support you in whatever manner for you to be able to get enough time to get your vaccine and enough time to rest after your vaccination.
Thank you, Dr. Lausa. We appreciate that information.
My pleasure.
This next question, it does come from us anonymously, but I feel like I've heard this one quite a few times from people. This one says, I'm a very healthy person. I never get the flu. So why would I get the vaccine if I don't even think I'm going to get sick from COVID-19?
Wow, that's an amazing question. The fact that you're very healthy, that's actually the singular reason why you should get the vaccine. Getting vaccinated keeps you being healthy, prevents you from getting sick, developing severe illnesses that will make you end up in the hospital and be in the hospital for so long, and unfortunately can cause other adverse, other serious outcome, which is including death. So it's good that you're healthy. Please keep yourself healthy. That's where you want to be. So if you like being healthy, like anyone would like being healthy, that's why that should be a singular push for you to get the vaccine. These vaccines work. We're talking about vaccines that have 100% protection against developing severe illnesses, 100% protection, preventing people from getting sick with COVID-19 infection and ending up in the hospital, and has 100%, and they have 100% protection in preventing you from dying. You cannot get anything better than this. We cannot get anything better than this. And we have federal government with all the institutions, CDC, various state department working so hard to get the vaccines in the hands of people. Please, the least we can do is for us to get this vaccine. I'm pleading with everybody. Please talk to your patient. You should get it. You should get it. Encourage your patient to get it. Encourage your family members to get it. This will save life. I've gotten it. A lot of our team members have gotten it. I was lucky when I got my own vaccine. I did not have any side effects. But even the people that had side effects, they're just mild symptoms. Like Dr. Shafi said earlier on, when you have about at the most 24 to 48 hours, and it's just viral-like illness that you have. You can take Tylenol, the symptoms will go away. So I'll repeat Lindsay's question. If you're healthy, because you're healthy, you don't get the flu, then I don't need to get COVID vaccine. Please, that should be the reason for you to get it, so that you can continue to stay healthy.
Thank you so much, Dr. Alausa. All right, let's bust another myth here before we get to our last question. I've already had COVID-19, so I don't need the vaccine. Well, we don't know how long the natural immunity lasts. Therefore, getting the vaccine will extend your immunity. The Center for Disease Control and Prevention, the CDC, recommends waiting 90 days after an infection before receiving the vaccine to extend that immunity even further. All right, Dr. Alausa, so we've gone through a lot of questions today, almost 15 questions talking about COVID-19. That's how complex this vaccine is, that it takes, we haven't even touched on this next question. And I honestly think it's one of the most important questions to touch on, because we hear a lot of people talking about the antibodies. So we want to know, Dr. Alausa, if we've had a positive antibody test, we don't need the vaccine, right?
No. You need the vaccine. The only way that anybody would, there are two ways that you can have antibodies to COVID-19, a virus. The first way is that people have obvious infection. They know they have COVID-19, but a lot of people have a symptomatic infection and they develop COVID-19. Your body develops antibody, initially IgG, which is the initial antibody that the body develops, then IgM. Then the IgG is the long-lasting antibody that the body develops towards any infection. This is science. We now know that previous infection with COVID-19 that gives you some antibody does not confer long-lasting protection against COVID-19 infection. But the vaccine, the way they're designed, they really ramp up your antibody production to a very high level that it's more sustainable. And what we're seeing now, if you've had COVID-19 infection, your antibody level wanes off after about 6 months. So previous infection will give you antibody, but that antibody level is not sustainable. And I know because COVID-19 is all new, and I took the time to actually do just a loose study on my own. I took the permission of my patient that they had COVID infection during the height of the pandemic, May of last year. I told them, let's check your antibody level. We checked their IgG and IgM and IgG level. Those patients had a high titer of IgG. Then by September, I asked those patients again, about 10 patients in all. I said, I'm very curious. I want to know if COVID-19 previous infection with COVID-19 will give you sustained antibody. So I said, let's check your IgG level again. We did. I'll tell you, out of every 10 patients, from the high level of IgG level in April, May, by the time we checked it in September, the IgG level had fallen to very low level. This is just a rough thing that I did on my patient obviously with their permission, because we're all learning. This is not a peer review study, but that tells me I can confidently tell you, at least in caring for my patient, we checked the antibody when they had the infection, they had a high antibody level, but 5 months afterwards, all those patients, the antibody level came down to a very, very low level. And Dr. Shafi, I'm sorry, this might be, it's not breach of HIPAA. You're also on this town hall. Dr. Shafi had the infection before he got the vaccine. We checked his antibody level, and when we checked it out later, it was very, very low. So previous infection with COVID that gave you antibody does not give lasting immunity. So you should get, if you've had previous infection, you should still get the vaccination.
Great. That's really good advice. Thank you, Dr. Lausa. And thank you so much for being here with us today to answer these questions.
It's always my pleasure.
Good. All right. Well, thank you again to our senior leadership for being here today, for all their insights and advice on everything COVID-19 as it relates to us and our patients. We want to thank our staff, both near and far, for taking the time out of their day to be here today. We know how busy you are. This meeting has been recorded for your convenience. So if somebody on your team wasn't able to join the live stream today, we will be emailing this out. Please forward it to them. If you have a team member or a patient who might be on the fence about getting vaccinated, please use this town hall as a resource, as a tool to show them so they can help be better informed about whether they are going to go forward with getting the vaccine or not. If you're one of our own who was on the fence about getting vaccinated, but you changed your mind after this live stream, please email us at any time at clinicalcommunications@dccdialysis.com. We'd love to hear your story and we'd love to share it. If you're not already following us, please do so on Facebook, Instagram, and LinkedIn. And we will be sharing stories about our staff and our patients who are getting vaccinated. Thank you, everybody, again for joining us today. Please stay safe and have a great day.
Thank you, everybody.